Christina Martin, here to do a cardiac assessment. This is my husband, Marshall. My patient is a 40-year-old male. To begin my cardiac assessment, I'm going to begin with inspection. When I inspect, I'm looking at the chest and its size. I'm looking for any abnormalities, any obvious abnormalities. I'm looking for chest rise and fall equally. I'm looking at the color, the temperature, and I'm looking for any obvious abnormalities that would be on the chest. After inspection, while he's just sitting up, I'm going to have him to lean forward. And at that point, I'm going to inspect also, looking for any abnormalities or anything that would be abnormal. I'm making sure with inspection that the chest rises and falls equally. While he's still sitting here, I'm going to go ahead and use I'm going to palpate his chest. And initially, I'm going to palpate the precordium. So I'm going to start here, noting that the PMI is at the 5th midclavicular intercostal space. Then I'm going to palpate the precordium this way, and then this way. At that point, I'm going to percuss to get the actual size of the patient's heart. Over the heart of the actual organ, it should be dull. I'm also, when I palpate, I'm checking for heaves or thrills and pulsations, but none are noted. Then I'm going to have him go ahead and lay down. And I'm going to continue with inspection and palpation. Again, I'm going to feel for palpation. I'm going to feel at the 5th intercostal space, midclavicular line. Feel this way, and then I'm going to feel this way. Of all of those, making sure that it is symmetrical. Then I'm going to go ahead and have him sit back up. And I'm going to auscultate after inspection and palpation. And I'm going to listen to the heart, and I'm going to listen to all of the valves. I'm going to start off right here. Start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm just going to listen to the apical pulse for 1 full minute. When listening, I am going to be listening for S1, S2. I will also listen for S3 or S4. S3 sounds like Kentucky. S4 sounds like Tennessee. Listening for these cardiac sounds. In addition to that, I'm going to be listening for murmurs. If I know to murmur, I'm going to listen for the timing, the duration, and the pitch of the murmur. And I'm going to listen thoroughly for at least 1 full minute to get a good examination of the patient's actual heart. And I'm going to ask the patient to lay down and face that way. And then I'm going to listen on the side. And I'll go ahead and let you sit back up. And that'll conclude the cardiac assessment.